Namaskaram. Very good morning to all. I think today the topic that we are going to discuss is one of the issue that of late has been affecting Indian population also to a great extent. It is multiple sclerosis. Now, I think multiple sclerosis was a clinical condition which probably 20 or 30 years back was most heard and seen in our Western countries, but now the incidence of this issue has been increasing even in our country. And now, as you all know, multiple sclerosis is an issue wherein there is an inflammatory response happening in the brain and spinal cord, which results in various neurological manifestations in the patient. Now, usually in the beginning of multiple sclerosis, the patient may feel only a headache and a diplopia, difficulty in focusing. So definitely optic neuritis, that is affliction of the optic nerve that controls the vision, is usually seen as the initial symptoms, which will be followed by other neurological sensory and motor manifestations like tingling sensations, altered sensations, difficulty in walking, etc. Now, when we think of multiple sclerosis, there are different types of multiple sclerosis like relapsing and remitting type. So it depends upon how possibly some disease can recur or completely remit and then again relapse. So these depends upon the various pathological severity involved in the clinical condition. However, the fact remains that the clinical observation is it affects mostly young females generally when compared to the male population. Now, what Ayurveda has got to do in the spectrum of multiple sclerosis management is, how we look at this issue is actually a pitta vata vikara. Generally, when we assess the patients who are having multiple sclerosis, we could identify some of the common issues that have actually led to the symptom. One thing is, a chronic period of stress, both very severe stressful life style, work stress or emotional issues in personal lives over a period. And then second thing is, very erratic lifestyle, especially late night dinners, untimely food, undergoing all kind of inflammatory junk foods over a period of time. Third environmental factor that we have found is actually getting exposed to different climatic condition rather than the already existing acclimatized climatic condition. We could see that Indian populations who are settled in other countries, especially in the European background cold countries, their incidence of MS among that population has been found to be increased, even though these are unofficial statistics. So environmental factor, emotional and physical mental stress, erratic lifestyle, I think these three things could be attributed to the possible pathogenesis which is actually triggering an inflammatory autoimmune response in the body. Now, so definitely somebody who is in early 20s and 30s have to be careful to have, the preventive aspect of, making our own lifestyle happy, having a stress-free life, etc. Now, once a patient has already suffered from this issue, what can be the possibility of Ayurveda? Definitely one thing is, to actually arrest the progression, to actually support the individual's system not to again come back with the same pathology. So what is the thing that many a times what we observe in cases is, if we don't curate the treatment very personalized, which depends upon how specific the individual's body is in terms of vata, pitta, kapha and the sapta dhatus in terms of Ayurveda, only understanding it very specifically we will be able to curate the treatment protocol which is very personalized. Generally, we don't have any specific multiple sclerosis treatment. It depends upon patient to patient. Like when kapha dominant, we have to go for rukshan or drying therapies. When vata dominant, we have to go for oil therapies, etc. So ultimately, there are many techniques that are utilized to detoxify the body, like Virechana, therapeutic purgation, Vasti, therapeutic enema, followed by some external treatments like, Abhyanga, various massaging techniques, and usually hot treatment like using hot oils, hot poultices, etc. are generally contraindicated in MS case, because as I mentioned, with the involvement of Pitta, these hot or Ushna Prayoga are not very much positive in that case. So all those things are looked upon very personally in individual case and supported in treatment. And once the detoxification happens through Panchakarma, the individual is put through various internal medications to pacify the vitiated dosha. And definitely there is a great role of yoga, pranayama, meditative practices that help in prevention and arresting the progress of MS. So as a community, let us utilize the services of Ayurveda in bringing back the patients who are suffering from MS to life normally. Thank you. Namaste.